Thank you for joining us today. I want to welcome everyone to the STS PAC Speaker Series. At this time, I'm pleased to welcome our moderator for the session, Dr. Keith Nonhein.
Good evening, and thanks so much for joining us. This is our Legislator of the Year award. We've been doing this now for 6 years. For those of you who don't know me, I'm Keith Nonhein. I'm a former president of the Society of Thoracic Surgeons, and I've been working in the health policy arena, both in advocacy, and currently am chair of the board for our Political Action Committee. We'd like to thank Representative Kim Schreier for joining us as we award her with the STS Legislator of the Year award. This is the 6th year for the Legislator of the Year award, and it honors a member of Congress who has been a firm legislative ally for us, especially on issues of importance to cardiothoracic surgeons. Representative Schreier has been a champion of STS advocacy issues during her tenure in the U.S. House of Representatives. She's represented Washington's 8th congressional district in the House of Representatives since 2018, and as with all Congress folk, she's up for re-election in 2022. Prior to being elected to Congress, Dr. Schreier spent her career as a pediatrician in Issaquah, working with children across the Puget Sound region and helping families navigate the healthcare system. Representative Schreier serves on the House Committee for Energy and Commerce and is a member of the committee's Health Subcommittee. And that committee has jurisdiction over many aspects of health policy, including Medicare payment. Last year, Dr. Schreier sponsored HR 6143, supporting healthcare providers during the COVID-19 Pandemic Act. And that helped to mitigate the Medicare payment cuts to providers. Because of Dr. Schreier's actions, surgeons narrowly avoided devastating cuts to Medicare reimbursement last year. Cuts of this magnitude represent a very real threat to the financial viability of cardiothoracic surgeons' practice and could result in limitation of patients' access to cardiothoracic surgical care. Dr. Schreier co-sponsored HR 5394, the Meaningful Access to Federal Health Plan Claims Data Act, in 2021, along with Representative Larry Bucshon, who, as you know, is a cardiothoracic surgeon from Indiana and a congressperson. This bill, if passed, would require the Secretary of Health and Human Services to establish a new program which ensures meaningful access to claims data by clinician-led clinical data registries. As you know, the STS for many years has been hoping to link Medicare claims data to our clinical database so that we can better assess the outcomes long-term, both with regard to healthcare utilization and with regard to quality outcomes. We track it out to 30 days, they track it out to 30 years. If we can link those two things, we can make great steps forward with regard to healthcare research. So she has been helping us try to gain access to that data. I'd like to present now Representative Dr. Kim Schreier, and thank you so much for joining us.
Well, hi, Dr. Nonheim. It's so nice to see you, and hello more broadly to cardiothoracic surgeons. I'm honored to receive this award, and just delighted to be with you today. You know, I think the first thing I would just like to say is how nice it is to meet with fellow physicians, because I think we speak a common language, whether that language is between me and Dr. Bucshon and the other physicians in the House, because with our common backgrounds, there is so much that unites our perspectives. And I want to say on behalf of, I would say, all the doctors in the House, we are deeply grateful for what you do for patients. We are keenly aware of how burnt out doctors are right now, and the threatened loss of not just cardiothoracic surgeons, but specialists of all sorts and primary care physicians. This pandemic has been really, really hard. We are well aware of the financial impacts during the pandemic, with not having patients come in, delayed care, elective procedures being postponed, and also about the ever looming threats to compensation. I hope that this experience with the pandemic has given the greater population more appreciation for doctors and nurses, and I would say everybody in healthcare. And we cannot take those providers at every level for granted. And if we're not careful, with pay cuts and other just barriers to practicing medicine, we may find ourselves in a position of not having you and other specialists when we need that care. So I also just want to acknowledge what you just said about the importance of data and making good decisions and making long-term decisions, because if you want the best outcomes, you really need that Medicare database. And it's an honor to work with Dr. Bouchon on that. So I want you to know that I am here standing with doctors. I would love to answer some of your questions, and just know that that as a pediatrician and a general pediatrician, I am able to hold multiple ideas in my head at the same time. And sometimes I feel like there is almost a competition between generalists and specialists, but the whole system can't work if we don't have both. And I think that we need to not create an either or situation, but just expand the pie, make sure our whole medical system works, and that the patient is centered in all of these discussions. So I'm delighted to be with you, and I'm honored to accept this award, and I'm happy to answer your questions.
Well, you actually just brought up an excellent point about trying to grow the pie as opposed to reapportion the pie.
Yeah.
Do you see any likelihood that anytime in the next decade to, I don't know, millennium, that Medicare might make some changes? As it is, we are it's like watching the Christians fight one another in a gladiatorial combat. Every time primary care gets a raise, specialists take a cut, or every time specialists take a raise, primary care gets a cut. Primary care has had a rough go, peds being part of primary care, and they have gotten some well-justified increases in reimbursement. But the way it's done with a fixed pie, it's just pitting one specialty against another. And I think it has negative effects on the House of Medicine.
I think you are right. And I think that we also need to just sometimes take a step back and look at the health of our nation. I know this is a broader, more philosophical concept, but we are not a healthy nation. And there are investments that we can make early. And, I'm talking about WIC and SNAP, like food programs. I'm talking about making sure kids have PE in school. I'm talking about stress levels and safe neighborhoods. There are things that we can do to just keep ourselves healthier. And there's also, these pilot projects that are supposed to be happening around the country on how to best use medical resources. Like, what is really the best bang for your buck? How do you do value-based care and yet not undervalue procedures? How do you strike the right balance? And it has been frustratingly slow to get the pilot projects approved. Many of us doctors united in a letter to get this, because if you can't get these projects going to see what the outcomes are, how in the world can you choose the best, most balanced system that provides value and makes patients whole and makes doctors whole?
Yeah, and unfortunately, the Medicare payment system is relatively broken. They promise alternative payment models. As you know, MedPAC suggested MIPS as a 1 year as this is going to solve the problem. 6 years later, they said MIPS, that's terrible. That's no good. That's a useless system. We've been trying to get alternative payment methodologies going. We've been petitioning Medicare, but I'm other than orthopedics, I'm unaware of any specialty that's been able to get an alternative payment model going with Medicare. And surgeons and most specialists feel sort of left out of the mix. Do you foresee any changes of that in the future? Do you think we're going to have any progress in terms of alternative payment models? Because the ones we've had to date, their track record honestly is checkered, is a kind adjective. Quality has not really risen and costs really have not been controlled.
So I share your frustration. I would also say that if I am remembering correctly, the orthopedic surgeons are not thrilled with their system either, because fees get bundled and you're compensated less with a bundle than with things done individually. And in an effort to do the right thing, it has caused frustrations with them. And so, it seems like we just haven't gotten it right yet. And we do need more of these pilot projects to get it right. And there are lots of creative people out there with good ideas, and we need more of these projects underway to figure out the best way to take care of people and keep the system functioning.
I have to represent cardiothoracic surgeons here because they pay my salary. God, I wish they did pay my salary, but they're facing essentially an 8.5% cut from Medicare reimbursement starting in January 2023, and this is, as you know, coming out of a multi-year public health emergency. On the one hand, doctors in general are told, you are healthcare heroes, we cannot thank you enough. And on the other hand, they're saying, by the way, you're going to get a 3, 5, 8, 10% pay cut. I just don't see that. Unfortunately, they seem to be talking out of both sides of their mouth. As the original sponsor of legislation that halted Medicare cuts in the past, do you see that happening again to try and resolve this situation this year? Is there some way we can come to the table and work out a more permanent solution? As you know, we were dealing with SGR for literally decades. We got rid of SGR, and now we've got, as far as I can tell, SGR light. It's the same essentially crisis every year with 8, 10, 11% pay cuts. And we're trying to figure out how to address this and for a longer period of time than 12 months.
Yeah, you nailed it. And what we need is a permanent solution to this, between the sequester and the cuts and the different payment models. Every year this comes up. Every year it is a crisis at the end of the year. I will tell you, because I sit on the Energy and Commerce Committee, that both the Health Subcommittee chairwoman and the chairman of the whole committee are well aware that this is coming up. There is bipartisan support for kicking this can down the road and giving you that reprieve. My understanding, I've only been in Congress for just shy of 4 years now, is that this always happens. That is always a last minute, Hail Mary kind of situation, and then there's a rescue. And so they know where I stand on this. I happen to think this is a good time for doctors to make their case, as we are losing physicians to retirement and resignation, as we saw what happened in the pandemic. Like, I feel like this is a moment to make a play for that permanent solution, and I'm working with my committee to help. There are times when doctors get more sympathy and less sympathy, and I think right now, as we're talking about needing more medical students and needing more residents and needing to incentivize rural healthcare, like all of these things, this is the moment to make life easier as a doctor, not harder.
Well, and we thank you for your efforts in the past, both in the reimbursement area and in the Medicare claims data. You know that in the STS, we believe that clinician-led clinical data registries can provide a phenomenal resource for the government, for CMS, in terms of quality assessment and improvement. The HR 5394, the Meaningful Access to Federal Health Plan Claims Data Act of 2021, what do you see as the future of that bill? Do you see that is something that has a chance for passing and that we might be able to get access to that data?
So we need access to that data, and it is great to work with Dr. Bouchon and to both be on the same committee to push this forward, because, again, if we're going to make investments in medicine, let's make sure they're the right ones and that we have the right long-term results. And like you said, nobody has the database that CMS has, that Medicare has. Where will this get through? I suspect it will go through with a big healthcare package. When will get through? I am not sure. Dr. Bouchon would probably give you better answers on that because he's been in Congress longer than I have. But please know that the chairman and the subcommittee chairwoman both know how important this is and how important it is, not just to doctors, like it's important to patients who rely on doctors to make the best evidenced decisions. And that evidence comes from real world clinical data. And this is the access they need.
What kind of advice would you give, not just to cardiothoracic surgeons, but to all surgeons, proceduralists, primary care folks who want to make progress, who want to help in the fight to convince CMS and Congress about the issues of healthcare burnout, about the frustration with reimbursement, about healthcare workforce shortages? What do you see as options for the Joe Q physician, your practicing doc, Mary pediatrician, Bobby rheumatologist? How should they go about trying to affect change in this healthcare environment?
So just like you are, STS, every medical specialty has its organization and its lobbying group, and you can lobby your state representative, your member of Congress, your senator, to make sure that we know what is going on and what's top of mind for you. I mean, it's not an accident that I'm familiar with these issues because we've had many conversations and I hear many of the same concerns from different medical societies. The best advice that I can give you is that stories stick with us. And so I don't know what your story would be, if it would be that one of your doctors is retiring and you can't bring on a new physician because it is too expensive to go to medical school and then to have so many years in residency to pay back these loans. Like if you paint a picture of the real situation on the ground, either as it affects the practice or the physician or the community or the patient, the stories stick with us. And they help us illustrate the case so that when we then go to committee in a hearing, we can share that story and make the exact same point. And so I just want to emphasize that the importance and the power of the story.
One of our young members who's early to mid-career wanted us to ask you the question about your personal transition from medicine to politics. He has both an interest in politics and kind of a hankering to make a difference, and wanted to hear your story and how you would suggest a young physician who's interested in health policy and advocacy. Is there a place for them in Congress? How would you go about working in that direction?
Well, I would love to have more physician colleagues in Congress. I mean, it's a House of Representatives, and we should have representatives from all different backgrounds and perspectives, and that is what helps us represent the country as a whole. And so I would welcome you to our Doctors Caucus. I'd also say that if you are thinking about going into politics, it is really important to just always remember your why. Like, what is the thing that is driving you? Because if you have a good motivation, authenticity resonates with people. And if you are running for a reason that is compelling to you, you can tell that story and make it equally compelling to others. And as a physician, you are starting from a place where people trust you and they trust you to work on their behalf, because that's what we do every single day, right? We listen to people's stories, we walk in their shoes for a moment, and we try to come up with the best plan together. And we don't ask if our patients are Democrats or Republicans or any of that. It is the patient that matters. And I think that's a way that you can really communicate, whether that is in your whole state or in a district or whatever it is. But if you keep your North Star as your why and what drives you, that authenticity resonates with people. And I think the caring soul of a physician also resonates.
I wonder if you might build upon the argument that you made with regard to the healthcare issues facing our country. You come at it from a different perspective than we do. We are a super specialist organization. We do highly complex operations. You came from a grassroots perspective. You were in the delivery room, you were in the examination room, you are seeing people who, kids coming in sick from school. You really are at the grassroots level. From your perspective, what are the most serious healthcare issues we're facing at the present time?
Thank you. I was also the one who would hear the concerning murmur and send my patients right to you guys. So don't forget.
Time to call us in. We're ready.
Yes. Thank you for saving so many lives. From the perspective of a pediatrician, looking at the duration of somebody's life, I think that looking at prevention is really, really important. And that affects you as well. I think that focusing on healthy lifestyles, healthy nutrition, exercise, kind of the basics will go a long way, but also early screening and early detection so that you don't get to a place where you need Herculean efforts. I was actually just at Siemens Ultrasound, which is down the street from where I am right now. And they make ultrasound equipment, and they have new technology that in a matter of seconds, they can ultrasound over your liver, and based on a representative sample of what they see on ultrasound, they can tell what percent fatty liver a person has. And incidence of fatty liver is going way up with obesity, with type 2 diabetes, looking at kids with metabolic syndrome. Like, this is a disaster. Mm. And long-term liver disease, I know I'm going a little bit longer for that is now or soon going to be kind of what heart disease has always been. Now we have the markers that can help us detect heart disease early. And this is a way to detect liver disease before it gets to the point where you need a transplant. And I think that notion of investing in prevention and early detection would be great ways to go. One of my big concerns right now in that same realm of prevention is what's going on with vaccine hesitancy in our country, particularly because of this pandemic and the politicization of vaccines and skepticism about the COVID vaccine. I fear that we are going to see a generation of kids whose parents have generalized that to all vaccines and are questioning the necessity. And here we are in 2022, seeing paralytic polio in New York. And this should give all of us a great degree of fear.
And if monkeypox mutates just a little bit, it may be smallpox again. And oh my God, we are going to be in trouble.
Well, I think it already mutated to some degree, right?
Yeah, look at how you're right, it did.
So we're missing something about how it's spreading. And I think we hopefully have learned from COVID that we should not presume we know everything about a virus, because viruses change.
Yeah, and we're playing catch up with monkeypox again. We're not behind as far as we were with COVID, but it's still true that the resources and the infrastructure that you had hoped would have been rebuilt and strengthened after the COVID disaster apparently hasn't been rebuilt and strengthened quite as much as we had hoped it had been. We're still a little bit behind the 8 ball with monkeypox.
Yeah, it's like another supply chain issue, right? Not being able to get the vaccine that you need.
Yeah.
But I think there's also an element of feeling a little overconfident at the beginning of all of this, that, oh, the only way you're going to get this is from very close physical contact. And I just think that we need to be thinking about, are there people with atypical presentations who are spreading it before they know they have it? I just think that we have to have our scientist investigator goggles on, and not be so presumptuous to think we know everything about this virus that's behaving very differently.
The polarization that we see in Washington is stark and really disconcerting. I think it's stoked obviously by social media and somewhat by mainstream media. It's a good story for them, so they keep poking it. If you were to believe mainstream media and social media, I would think that you guys in Congress are walking around with knives and guns in your pockets like the Jets and the Sharks waiting to rumble. Is that what it's really like in Congress? The red versus the blue? How much polarization is there? Do you really talk to your colleagues on the other side of the aisle? Is that kind of polarization overblown, or is that what we're facing in the early part of the 21st century?
There is unfortunately a great deal of polarization that is particularly acute with big packages. So the packages that are getting a lot of attention that might be considered big wins, those are the ones where it just becomes very hyper partisan. But every day I'm working with other members of Congress in the other political party on issues where we find agreement. Dr. Bouchon and I are in different political parties, but we know the value of having data to make good decisions. And I am finding that in a lot of places, that is the case, that we need to search out what we agree on and find partners. And the only way to fix Congress is, well, that's one way. One way is just each individual at a time has to work. The other problem, in addition to social media and information vacuums where we are just only hearing one opinion, which is incredibly dangerous. The other problem is a structural problem with Congress, which is that there are only 30 seats out of 435 that are swing seats. Everything else is preordained. So if you are in a solid R or a solid D seat, there is no incentive for you to come toward a common sense, pragmatic center. And so the fear there is that you will be outflanked either farther to the left or farther to the right. And so it really disincentivizes that cooperation. That is a structural problem. I am in one of those swing seats, which is, why you are seeing a pragmatic centrist Democrat talking with you today. Because I understand where the country is and I understand where my district is, and that we need to find the places where we agree. And until we have an end to partisan gerrymandering, we're going to continue to have this kind of conflict that exists in Congress that does not exist, by the way, with Republicans and Democrats, like at the city council level, or, whatever it is. So I think that there's some really very big structural changes that have to be made.
One of our members wanted to talk about the balance of payments. As you know, only about 10% of the total healthcare payments, the total healthcare outlay, goes to pay for physicians. 90% are non-providers. But it seems that fraction of the pie that goes to providers, and it's not just providers, it's doctors, it's nurses, it's respiratory techs, that seems to be either static or sometimes, in the case of docs, if you look at the conversion factor for us for Medicare, it's decreasing, while the reimbursements to pharma, to pick one, hospital administrators, to insurance providers, to non-providing personnel and administrators seems to be rising year by year. Is there any way that can be rebalanced? Because as you know, healthcare workers, whether it's your respiratory therapist, your phlebotomist, your nurse, your doctor, any of them, they're the ones that have been on the front lines during this pandemic, and they just see what they consider an unfair balance in terms of that reimbursement.
Yeah, I would agree with that notion. And I mean, especially as we're looking at high gas prices and inflation, high grocery store prices, you're feeling that even more as labor costs go up as well. I think a lot of physicians, in particular, like private practice physicians, are feeling that strain because reimbursement has not increased. In fact, it is threatening to decrease. I will tell you that we are taking this on in various ways in Congress. I mean, first of all, it was an absurdity that when the Affordable Care Act was passed, something that was carved out of it was the ability of Medicare to negotiate the cost of prescription drugs. That was a lobbying effort by Big Pharma, convincing people that there would not be innovation if, God forbid, there were some negotiation of what the biggest payer in the country would pay for prescription medications. So we have just passed a healthcare and climate bill that finally is giving Medicare that power with the most expensive drugs. And we need to continue on that path, both for in-hospital and out-of-hospital drugs. And when I talk to people who are the CEOs of hospitals, they tell me that their number one expense is actually pharma. So we've made a dent there. In terms of insurance, one of the good things in the Affordable Care Act was that it capped insurance company profits. And anything beyond that has to be given back to the people who are subscribed to that insurance. And so we are continuing to try to make this a fairer system. And I am continuing to try to make sure that your reimbursement does not get cut and that we keep perspective on where the big spending in medicine is really happening.
Can you tell me, I know you're from Issaquah, and I read a little bit about Issaquah just because I never knew where the hell it was. It's a bustling metropolis of some 40,000 people right on Interstate 90, and it's south of the Sammamish Plateau and north of the, as far as I can tell, they call it the Issaquah Alps, the mountains to the south, and it is a little east of Seattle on the outer skirts. It would be the exurbs, I guess, of Seattle. What are the people there thinking? Are they having healthcare problems? Are they having difficulty with access to care? What do you talk to them about what kind of complaints do they have about the healthcare system?
Yeah, that's a great question. Issaquah and Sammamish, where I live, is a suburb of Seattle. We're about 25 minutes east of Seattle. And this is an area where a lot of people who work in tech, Microsoft, Amazon, Google, live. And so this is an area of this, and by the way, my district is 10,000 square miles, but like this little part, the suburbs of Seattle, this is an area where people generally get their insurance from their employer, and they are not struggling as much as people in other parts of the district who are buying insurance off the exchange, who may not have great insurance, who are paying out of pocket. Seniors in many parts of, really everywhere, who have very high out-of-pocket caps for medication expenses, which, by the way, in this package we just passed a couple weeks ago, caps seniors out-of-pocket drug expenses at $2,000 a year. So these are places where we are making big improvements. And then I have some very rural areas in this, again, 10,000 square mile district where there's only one insurance provider. And that means there will not be a robust network, and it means there's no competition. And it is one of the reasons that I'm in support of having a public option that people could buy into as an alternative to something on the Affordable Care Act if there's no competition. So yeah, affordability and drug prices are a big issue.
Okay. Tell me about your race. How difficult is it? Are you neck and neck? Are you coming from behind? Are you an easy winner with 2 lengths ahead? And what are the differences between you and your opponent this year?
Neck and neck. And I don't even know how much, because this is an official side event. I don't know how much I can say, but I will say neck and neck. This is truly a 50-50 district. We have a top 2 at like a jungle primary here that we just had a couple weeks ago. It was on August 2nd. And if you add up all the Democratic votes, which pretty much is me, and you add up all the Republican votes, they were dead even. It was like 49.5 and 49.4. I mean, they are dead even, and there's not a lot of undecideds. And so it has been rated as a toss-up district. It is truly a toss-up district. And I'm going to make sure that this is not decided with a toss of the coin, and remind people that I am the community pediatrician who's taken care of their kids for 17 years before running, and that I'm the only pro-choice woman doctor in all of Congress, and that I think medical decisions should be made by patients and not by the government.
And do you think the Dobbs decision has made it harder or easier to get healthcare legislation passed, or has it just polarized people more and made it more difficult to make non-emotional or objective arguments?
I think it is a non-emotional and objective argument that women should be able to make their own healthcare decisions and that government should not make it for them. I think people are activated and understand how important it is to vote and that their vote matters. And hopefully they have seen a Congress that has now twice passed a bill that would make Roe the law of the land, and understand that keeping this current Congress, which includes me, and having a pro-choice majority in the Senate would make this issue go away, and that we could make Roe the law of the land through legislation, and that voting matters. It is up to the people in this country to decide how much it matters.
One of our members asked about the possibilities for reining in the insurer prior approval processes that add so much to administrative costs. We have literally personnel, the offices of personnel within our hospitals that do nothing but ask for prior approvals, as if, you know, me ordering a CAT scan is going to somehow enrich me and put $1,000 in my pocket. There is he notes the anecdote of a pediatric cardiologist who spent an hour with a medical director from an insurance company in another state who didn't even understand what the congenital defect was and why the repair was necessary. And that person was essentially passing judgment on whether or not it was a life-saving procedure. We've all, every clinician who's gotten on a peer-to-peer phone call has gotten on often with a doctor who, yes, they have an MD, but they haven't the slightest clue about the issue or the process that we're discussing. Is there any way to rein in that problem? Because it not only adds to the frustration, but certainly the cost of healthcare.
Yeah, there sure is. There's a bill called the Seniors Timely Access to Care that I believe at this point we've passed through the House. It has many, many co-sponsors. It awaits action in the Senate, and you can double check me on where things are, but that's the exact idea, is that there, and we just saw this with Medicare Advantage as well, that there are so many steps to pre-authorization. It's almost like they're waiting to just have something catastrophic happen and drag their feet so they don't have to pay for a procedure. And there have to be carve-outs. You know, when there are procedures that are approved 99% of the time, it's time to stop asking for pre-authorizations. If there are doctors who always get authorized, it is time to stop auditing them and asking for pre-authorization. And so this is a bill specifically targeting seniors to streamline this process and not hinder access to care.
Another of our members asked about we talked a little bit about the old SGR and the SGR Lite or SGR 2.0 that we're working with. And he makes the point that we've been working with our senators and our representatives for the last literally 3 election cycles. The fundamental issue, however, seems to be the oversight of Congress over CMS. Every time CMS makes a decision that seems to hurt physicians or medicine in general, it comes to Congress to act in their oversight capacity to fix it. Is there any energy or any interest in Congress in trying to reorganize it so there's more direct congressional direction over the Medicare, Medicaid services, so we don't? We're replaying this year after year after year and always coming up with the same result.
Boy, I might have to noodle on that question, because I don't know if I would want members of Congress diving that deeply into medical decision making. And so I like the idea of oversight. Let me noodle on that a little bit. Because if we have the right people in CMS who are listening, these decisions may best be left to professionals, just like I don't think Congress should take over the job of the FDA and those kinds of things. So let me noodle on it.
Okay, and it's interesting because, you know, the Medicare seems to take a lot of its marching orders from MedPAC, and MedPAC consistently has said over the past several years that Medicare reimbursement is just fine the way it's going because 92% of seniors can't have access to Medicare. And essentially, they believe that as long as seniors have access to Medicare, that essentially Medicare is overpaying. And until they see a marked drop, until there is some catastrophe where suddenly 10% of the geriatric population can no longer get care, that's when they're going to say, oh, yeah, maybe we were underpaying them, but it's going to be a disaster. And I can tell you, the blame isn't going to go to MedPAC. It's likely going to come to us. They seem to have a very anti-physician approach, and I'm just not certain where that comes from, or if you can shed any light on their recommendations.
MedPAC is made up of the medical societies, is it not? Do I have that wrong?
MedPAC is made up of individual specialists. Some are physicians, sort of, I think, a little bit part-time. Some are economists. Some they pull from a broad range of people interested in healthcare, but for the most part, they are. I guess, you know, the town gown, the constant conflict there is that the town believe they're the doers and the gown believes they're the thinkers. These people are definitely thinkers as opposed to doers. They are academicians. They are philosopher doctors, but I'm not certain how much actual clinical activity they have. A lot of the decisions that are made for us are made by people who really aren't that clinically active. Whether it's the adjudicator for the insurance company, whether or not it's the CMS official, the physician that's determining whether or not the healthcare we provide is worthwhile. MedPAC's the same way. A lot of the decisions seem to be made by people who really, honestly, aren't in the trenches and aren't that familiar with the day-to-day problems and travails of the working physician. And I guess that's a vent on my part. I'm sorry that's not a constructive question, and there's really no constructive criticism there. It's just part of that of the frustration that people are feeling, and part of the reason that burnout really is occurring. And I don't know if you've seen that in pediatricians, but we've seen that in cardiothoracic surgeons.
Burnout is a huge problem, I think, across the board, maybe less so with pediatricians because we're generally just.
You're happy people. You're happy people with little happy people. Our
Right.
people are not happy, the people we're treating. They're old and they're debilitated and they're unhappy. So that's technical.
You know, it's really hard, and there's a ton of frustration. And you know, if it does feel like this force of like ratcheting down and kind of being so tight with reimbursement is resulting in several things. I mean, first of all, I don't know if it would be the case that if suddenly doctors stopped seeing Medicare patients, that CMS would increase reimbursements. I don't know if that is really the case because we see that happening with Medicaid and reimbursement rates have not gone up. And so I am not sure if that really truly would follow through. I think the other pressure that it's putting on doctors, on offices, I mean, you still have to hire nurses and staff and people to do all those pre-authorizations is the financial strains are going to end up consolidating our medical system into a very, very small handful of healthcare organizations. And there are benefits to that, but there's also real risks to that. And I think we have to be thoughtful about the policies today and how they will push our healthcare system going forward.
Well, I'll tell you that there are such frustrations and such burnout. I don't think the answer is you couldn't get physicians to stop seeing Medicare patients because every one of us took that damn Hippocratic oath, and everyone really believes that as much as you'd like to have a work action, as much as you'd like to get the attention of Congress, of Medicare, I don't think any of us from a moral perspective have the wherewithal to say no to a patient when they come to us in need. I just don't think that's in our DNA. We can't do that. So, and unfortunately, I think Medicare and insurance companies sort of know that and know that we will show up when the fire bell rings. We're going to step forward and we're going to provide care day in and day out. And that's both something that's frustrating, but also something, frankly, I'm kind of proud of our profession as a whole.
Yeah, I don't think doctors make that decision. I think that happens at the medical system level, where they just look at the bottom line. If you are a hospital system and you are, constantly in the red, that just like they have done with Medicaid, many of them will just cap the number of Medicaid patients that they can afford to have in their system. And I worry about that happening with Medicare as well. So looking for efficiencies across the board and adequate compensation for physicians and hospitals and specialists. I think this is a nuanced discussion, and I'm glad to be there with the other doctors in Congress from both parties expressing what we hear from you, from our colleagues about burnout and frustration. And on top of all of that, feeling like you're not being paid what you're worth.
Well, I want to thank you you've been very generous with your time and with your knowledge and your insight. We certainly support you because you have, I think, the best interests of not just doctors, but of your patients at heart. And you folks like you and Larry Bashan, I think, are the reason that any of us have some faith that there is some hope in Washington, D.C. and in the political system. Once again, congratulations on being Legislator of the Year. I will say that Congresswoman Schreier will get the award at our advocacy meeting. If you guys any of you are coming to Washington in 2 weeks to our advocacy meeting, she will be there and we will present her with the award at that time. But once again, thank you so much for your time, and it's been great talking to you.
Well, thank you, Dr. Nonhein. It's wonderful to talk with you. Thank you very much. I'm honored to have the award. I look forward to seeing you in a couple of weeks in DC.
We'll see you then.
Thank you all for taking care of patients. Take care.
Bye-bye.